Hello, my dear colleagues, dear friends. I am very happy to spend this evening with you all and share with you some amazing information today. Please text me or you can hear me and see everything well for understand or everything is correct in our presentation. We will wait a few minutes for other participants and we will start. I hope and I am sure that you will enjoy our webinar because this unique and beautiful technique can improve our work, our connection with patients, and I'm sure that can improve our results and give us a lot of experience. Please write me. Oh, everything okay with the sound and with the screen, or you can see the presentation. If somebody of you will have any question during the webinar, you can write everything wherever you want and I will respond. Okay, let me start. So today we will speak, today we will sometimes, all good, thank you a lot. Today we will speak about wonderful technique that calls scars reverse technique. This is my own technique that I created for doctors and for our patients, of course, to receive good results and to have opportunity to treat some difficult problems that we can see and we can have in our practice, like scars, and especially atrophic scars like post-acne scars. So today I will present you this technique and I am sure that you will like it. Let me introduce myself. My name is Tsebrovska. I am creator of this technique. I am a doctor of aesthetic medicine. My experience is more than 14 years. And I have a lot of my own techniques and methods to treat different illness like acne, like hyperpigmentation, body contouring, and also I am proud that I am key opinion leader of Innoaesthetics, and today all our technique will be connected with product of this amazing company. This technique called scars reverse. That means that maybe and probably we can reverse the scars that our patient can have. So let me speak a little bit about acne. You know perfectly that post-inflammatory changes in the skin, of course, will provoke tissue response. And any inflammation cause this response, and the response can be also different, like scars and pigmentation issues. These pigmentation issues can be hyperpigmentation or hypopigmentation also, and also can be scars. Post-acne scars is quite a popular problem that our patients have after scars, after acne, sorry. We had clinical studies, a lot of clinical studies, where was more than 25,000 patients with acne. And also we saw different risk factors that can be associated with acne scars. First is males. So men usually suffer from acne and post-acne more than women and have more hard form of acne. Then family history, usually from mother to her children, we can see that genetical connection. Also, acne severity. Some important aspects that we need to understand before start to treat the scars, post-acne scars. As more hard acne form we have, as more difficult post-acne scars we will receive. Yes, I think everybody understands, and it's very logical. We can see that chronic illness provoke very strong acne as post-acne scars, and also late onset of treatment. Sometimes many patients who came with their children, for example, in my own practice, they came with children with hard acne, and they try to treat this. When I prescribe everything what they have to do, home care, some different medicine, maybe some diet, some treatments in the clinic, very often parents can tell that, oh, I'm sorry, it's too difficult and it will take so long time, we don't want, and maybe my son or my daughter, he will grow and have an intimate life, and his hormonal status will change and acne will disappear. Many parents think this in my practice, and it's very pity, because when we don't start the treatment in time, we will have this negative effect of the acne. So deep form of acne, usually we can see on patients who didn't receive treatment on time. And also some our patients start to do self-medication. They check in YouTube different methods, different supplements, and different treatments that can do at home, and sometimes they are really crazy, and they provoke this bad effect, the side effect of this self-treatment, and also secondary bacterial viral complications that we can receive, like secondary effect. Consequence of acne. First, what we can receive is atrophic scars, when we have minus of tissue, some holes, imperfection on the skin. The second, what we can receive is another another type of scars. It calls hypertrophic scar, when we have plus tissue and plus skin tissue rising above the skin, and we call it hypertrophic acne scars. And also we can treat it with this technique. I will teach you how to do it. It's very interesting work, and also we received very good results with this. Another thing is dyschromia, when we have hyperpigmented marks, areas that appear on the places where acne was. Another type is hypopigmented areas, when we have another type of pigmentation. This also can be. Here I represent you quantity scale, where you can evaluate the situation of your patient and maybe prognose how will be successful this treatment that you will decide to do. A little bit about atrophic scars. It's a first type pathological scars. These are imperfections with less tissue. Yes, when we see the little holes or waves on our skin tissue. They can be different types. According to the Dr. Jakob classification, we have three types of scars, like ice picks, rolling scars, and box scars. Rolling scars are more superficial of these all three type of scars, and they are much more easy to treat and is more favorable for them. Box scars are a bit deeper, but they also can be treated and reversed very well. Ice pick scars are quite difficult to treat, and usually they have like V-shaped form and reach very deep to the dermis. That's why it's very difficult to get them, to get the tissue, to get to the alive cells to produce and stimulate different processes that can reverse the scars. But also we can treat it, of course. According to this different type of scars, we can see that they can have different sizes and how to classify them. For example, ice pick scars have a very small diameter, less than 2 millimeters, and usually can they are deep but little diameter, but very deep. Rolling scars are large, more than 4 or 5 millimeters, but they are superficial and they can be covered with cosmetic. Box scars have medium size and the shape is like a square and can be shallow or deep. Therapy of atrophic scars that we can do in our clinics, in our practice, how usually we do. It can be dermabrasion, but is very dangerous for some type of patient uh, who can have a keloid growth tissue. Sometimes such patients also have acne, post-acne scars or different type of scars, and we cannot do any aggressive influence to them because we will provoke another growing of extra tissue. How to check for this patient? Can have this extra tissue, keloid scars or not. Usually I check it on the holes that we have with earrings. Is everything is okay? We don't have extra cells, that is okay. And also on the knees, because all of us for sure hurt our knees in the childhood, and usually everything is okay. But if from childhood our patient keep the scars on knees, maybe we can think that this patient have a problem with keloids, and then we cannot use anything aggressive because it can be a big risk for us. Another method of therapy is microneedling. Microneedling is quite good and shows a very good results. And it's this multiple skin injuries and needle punctures stimulate recovery of the skin, because when we damage skin, we stimulate recovery. That's why this is a quite good process and very controlled that we use in our technique, and also we can use it separately, of course. Another therapy for atrophic scars is chemical peel. When we remove the old skin, injured skin, and we stimulate growth, new tissue, new cell is like to push the skin for recovery. It's negative stimulation, but it is also stimulation for recovery. Then another type is the thermal fillers, when we fill the hole or imperfection with hyaluronic acid. When we create that lost volume with different type of fillers, but usually we use fillers based on hyaluronic acid, and usually they have to be specific and very, very soft. Another way to treat is subcision. When we break this fibrosis connection, that create this minus tissue. And it's also very important because if you want to inject some dermal fillers to this fibrosis tissue, we cannot do it accurate and we cannot do it well, and we cannot make good proliferation because of this fibrosis tissue. That's why when we cut this, when we break it, we have the space where to inject and where to work, we can say. It's also very important, and this treatment also I used in my technique with microneedling. Also, we can use different type of lasers and different equipments that we can have in our clinic. But I wanted to create this technique without using any optional equipment because of several things. For example, not every doctor have lasers or equipment, and also not every patient can use it or have possibility or have cannot have money or cannot have time for recovery, for example, because it's also quite aggressive. That's why my goal was to create something that every doctor can use in his or her practice, and something easy to perform, something easy to any level of professionality of the doctor. And you will see this technique is very, very simple. Also can be surgery, of course, and about microneedling. As I told before, is very common to use because multi-cycle injection will stimulate recovery of tissue, growing another type of cells that we need when we want to reverse the scars. Also, there are a lot of clinical studies with women and men, and they shows amazing results for recovery. A lot of patient has this difference in their skin quality. For example, a lot of patients with grade 4 of scars show 2 grade improvement. Is a lot because it's quite visible and good result. And for example, 20 patients with grade 3 scars showed a 1 grade improvement that also is very, very good. So they improved by 2 grades. It's quite great the result. That's why I used this method in my technique. But of course, I used also some solution for have this opportunity to penetrate something on tissue. And I used DNA peptide from Innoaesthetics. Why DNA peptide? Because of its formula and active ingredients. The most important one was polydesoxyribonucleides that can recover the DNA of our cells. So we can recovery, we can say that the old cells that quite dead for a moment. And also a specific peptide complex for recovery the tissue. Of course, glutathione, like very strong antioxidant, and sodium hyaluronate. Sodium hyaluronate is also very important for extracellular matrix. I'm sure that you all know that every cell has to feel comfortable themselves on a tissue. That's why it's very important extracellular matrix. And extracellular matrix contain a lot of sodium hyaluronate. Without hyaluronic acid, our cells cannot work good. They don't want to work, they don't want to live because they don't have any power and any energy. That's why hyaluronic acid also is very, very important for normal function of the tissue and all cells. Polydesoxyribonucleide is very, very important in this step. And also, I want to tell you that we saw a big growth of endothelial factor. It means that we stimulate good microcirculation. You know that any cell eats the food, any serums, any cream. All cells can eat and live with everything that blood will transmit to the cell, will deliver to the cell. That's why without normal, good microcirculation of blood, we cannot expect any good work of any cell. That's why we stimulated angiogenesis with polydesoxyribonucleide. And also, we contribute to the regeneration of glycosaminoglycans and glycoproteins. And we stimulate pre-adipocyte proliferation and epithelialization. That is also very, very important in our case. Also, specific peptide complex that will stimulate protein synthesis in the extracellular matrix, such as elastin, and very important first and third type of collagen, and also fibronectin. And also activate different growth factors that will help us to renew the skin. Also glutathione. I am sure that you know how is important glutathione, and it have very strong antioxidant effect. And I prefer to prescribe my patient glutathione like a supplement during the treatment. It also can help a lot, so you can do it. And you will get much more better result for sure. And hyaluronic acid. All of us know how hyaluronic acid is important. We need to control hydration during repair periods and inflammatory processes. Because when we have this repair period, our patients don't feel comfortable themselves. And that's why it's very important to maintain their normal condition. So hyaluronic acid is quite important. So we are doing microneedling with DNA peptide like a first step. The second step is injection of specific, very elastic fillers that calls mesh scars. It's fantastic products that we can use not only for scars, but for superficial wrinkles, for these wrinkles that we have on neck, deep wrinkles that we have in frontal area or close to eyes. When we afraid to treat with normal fillers, because when we inject deep, we can have very big risk of ischemia or embolia. That's why superficial injector we prefer to be secure. This filler we can use superficial and have a good results. Indication, scar correction. But of course, a lot of scars, a lot of wrinkles also we can call like a tissue scars. That's why this filler can be used for superficial wrinkles and for deep wrinkles also. A concentration of hyaluronic acid is 20 milligram per milliliter, and cross-linking agent is BDDE, that is less toxic that we know for nowadays. And this filler is very, very elastic, very soft. We can play like with plastilin with this product. It's really fantastic. We are doing this treatment once per month. Usually I use needle or 30G or 27G. You can choose what is more comfortable for you and use that type of needle. Application technique can be point by point or a retro tracing injection. It depends on the type of the scars that we have. I prefer in my practice working with scars to use point by point technique. Another step, the third step, the final step of the technique is to stimulate negativing, is a negative stimulation of the tissue. When we stimulate recovery with injuring, yes, with something hard, with something negative, it is chemical peel. Because first step that we are doing, microneedling with DNA peptide, is positive stimulation because we are giving material for recovery the cells. That's why it's positive and it's very, very positive step. This third step is negative, but also they both stimulate recovery just from another ways. Skin recovery pill, why I chose this pill, exactly this, because of its ingredients that I need in my case to treat acne or post-acne scars. For example, salicylic acid is very good keratolytic. Mandelic acid is very strong antibacterial ingredient and also have this pigmented effect, and mandelic acid have very big drop of the acid. It means that we will work very superficially with this product. But also we have resorcinol that I love the most in this formula because resorcinol have very strong anti-inflammatory effect. We can say that resorcinol is cutting the bad and dead tissue and stimulate this recovery and reparation of skin very quickly, very fast. And also resorcinol works in different areas and stimulate uh, a lot of processes that we need in case of people with post-acne. Sometimes they have not only post-acne right now, but a few similar inflammation on the face. And it's very important to predict, to prevent the new inflammation process. We cannot predict or this patient will have inflammation or no, and we cannot risk. That's why better to prevent with this pill and also stimulate keratolytic effect, stimulate recuperation, and stimulate different recovery processes with these ingredients and this chemical pill. Also, of course, we can use this pill separately for our patient who who have acne, who have different inflammation and imperfection, and also post-acne hyperpigmented marks. And also, this pill is very, very good for stretch marks. I will show you how this technique works, not only with post-acne scars, not only with atrophic scars, but also with stretch marks that have very similar pathophysiology. That's why we always, like a doctor, have to have clinical, clinical brain, clinical imagination, and looking to the ingredient, we can understand what we will stimulate with this or that product. That's why it's very logical to understand that post-acne scars, the tissue that is growing there is very, very similar with stretch mark tissue. So now the most interesting part, application protocol. First of all, we have to clean the skin with Innoderma or soft cleanser or deep cleanser. It depends on the doctor it depends on the patients that we have. We can choose one on another one. Then we have to disinfect the area of treat with different antiseptics that you can use. For example, I prefer to use chlorhexidine, but if you don't have anything, you can use our degreasing solutions that can also disinfect the area very, very well. The next step is microneedling with applying DNA paste using a dermapen or dermal roller. But also, if you don't have any of these tools, you can use your simple needle, making a multi-cycle injection on the tissue with your hand. It will be the same. So it's very easy to do this treatment with everything you have in your clinic. So dermapen, derma roller, or simple needle 30G with this multi-cycle technique, or some technique like nappage also can be. The third step is to inject mesh scars. Scar correction. We inject mesh scars, this soft filler, this unique filler, only to the areas where we have the scars, the minus tissue. So we have opportunity to fill such areas that don't have the volume and create this artificial volume, we can say. So we inject point by point where we see this imperfection. And very slowly, we have to be very accurate. We have to inject very accurately to the scars, inside of the scars, and it's very important. You can do hypercorrection of the filler when you see the papule that is bigger than the hole you have, and it's also very good. You can press this papule, this ball, and then dissolve the product inside of the tissue. Is very, very soft. Then the next step is to apply a negative stimulation with our Innoaesthetics skin recovery pill. We treat the whole area, all the face with this pill, and then we wait few minutes, from 2 to 5 minutes, when this pill will be absorbed to the skin. Then we did not wash it, do nothing. If you will have the frost, everything is okay. Also, don't be afraid of this. This is a good sign that we get to the alive cells, and also it will stimulate very, very good recovery and stimulate the growing new, young, and healthy cells. And then we apply skin repair cream and leave this all this treatment on face of our patient. They have to they wash out everything at home after 2 hours. And again, apply at home skin repair cream and use this cream no less than 2 weeks in a row for good recovery. Also, our patient has to use sun protection. For sure, because we used chemical peel, we used a lot of injection. That's why the skin will be damaged and is very dangerous if we have sun or summer. So sun is very active to prevent pigmentation, hyperpigmentation. I want to show you this video of application. Step by step. The first, as you remember, is microneedling with DNA peptide, our TDS product, transdermal product. Here I used Dermapen, but it can be derma roller or simple needle. Just we need to damage the skin or stimulate regeneration. Here I used Dermapen with depth 1.5 millimeters. When you work with body, like belly, stretch mark, for example, of some parts where you have more thin tissue, you can use different depths from 2 ml, from 2 millimeters to 0.5. So everything depends on the type of skin of our patients. This patient had this acne after car accident during 8 years. So she had and hypertrophic scars and atrophic scars. And we get very good results. When you want to treat hypertrophic scars, please not inject inside of scar, but inject close to the scar, our measure scars, because hyaluronic acid has defibrosant effect also. So it will make our fibrous tissue more soft. This is the goal of hyaluronic acid that we inject like a second step. I will show you. But when we have atrophic scars, we inject directly inside. You're welcome. Second part of our protocol. I use 27G, 27 gauge needle. But of course, you can use 30 gauge. Very slowly. Don't rush, because this work has to be like a jewelry work. Very accurately. You see, here, hypertrophic scar. So I inject close to the scars. But when we have atrophic scar, we inject inside of scar to create plus volume. It can be point by point or linear technique also. Depends on the type of scar. And then press for have good distribution of the product inside of skin tissue. With these products, we have influence to fibrotic tissue and make it soft. Hyaluronic acid have different effects, not only hydration, but the fibrosant also. And very often we forgot about this. You can put the product until you will see white ball white skin, white color. It means that we separate different level of tissue, that we are in between of them, and we are quite superficial, and we stimulate this ischemia, that is very positive in this case, because stimulating little microischemia, we stimulate very quickly another strong microcirculation to that area, and we will stimulate regeneration to that. You can see this patient is without any anesthetic cream, any anesthesia, and this procedure, this treatment is very comfortable for the patient. As you can see, very easy to do it. Just to switch on your imagination and logic where and what to do. Every time you will need less and less product because not everything will disappear. For example, first session, maybe you will use all syringe, all 1 milliliter of the product. But next session, in 1 month, I guess you will need only half of milliliter because some of minus tissue will be established. So that's why you don't need extra product. But some of them will disappear, and that's why you need to inject again to add more of hyaluronic acid. But each time you will need the product less and less. But like a life hack in the end, when you have your extra product, better not throw out, and you can inject on lips also, or different wrinkles that our patients see like a bonus. Is very easy and very beautiful. The third step is to apply skin recovery peel that we call negative stimulation with different type of acids. You see, I didn't put the greasing solution here. Why? Because I don't want to penetrate this solution, this peel, too deep. I need to work in a specific level of dermis. That's why I didn't use the greasing solution before, and I am very safety with all this application of all this product. In the end, applying skin repair cream, make a soft massage. Please don't do it hard or not to do any extra aggressive movement. And in the end, if you need, we can apply sun protection cream and leave it. Our patient will wash out all this product at home after 2 hours and apply again skin recovery, skin repair cream, and will use this cream during 2 weeks after the treatment. And okay, let's do the next. Also, I want to show you another type of injection when we have atrophic scars, when we have minus tissue. How to inject in this case? We inject exactly inside of this imperfection and push until we will see a little hypercorrection. And then in the end, we will press the product with very soft massage to proliferate it inside of the skin. Yes, we did, like a first step. Microneedling, we did the subcision, soft but subcision. That's why to inject hyaluronic acid, like a soft filler, will be very easy. Yeah, I use it 30 gauge needle, you see, the yellow one, to make the process more comfortable and less painful to my patient. Don't be afraid to inject superficial because a lot of doctors afraid. With this product, you can be sure that you can push and with massage to remove this extra volume until the normal level of tissue and create the flat skin. Like a bonus to my patient, because I had the fit amount of product, I injected into lips, and you can see immediately a very beautiful natural effect of hydration and not for volumization, for refresh the skin, refresh the lips. So we never throw out the products. It's our money and money of patient. And if you will give them such type of bonuses, they will appreciate you a lot. Here you can see the result of this patient. It is amazing. She was crying because she was with these post-acne scars for many, many years, more than 12 years. And now she get the result like after a laser. You can see before and after only 2 sessions how beautiful and result, and your skin looks very healthy. And also you can see color of skin. She have a bit irritation before and a very bit vascularization, and also she had a little bit of cuperosis. And in another picture, uh, picture after 2 sessions, you can see the color of skin is very healthy, and you don't see this enlarged vessel. It means that our DNA peptide product of TDS works how I told you in the beginning. We stimulate the growth factor of endothelium, and also we stimulate we stimulate growing on new capillaries, and we create a good microcirculation. From another side, look, the cheek is very soft, is very flat. Now, this patient already we have, I think, 1 year and 2 months period before our meeting with this patient, and she still have this good result. Look, here I wanted to present you how can be the result even after 1 session. you can see that also is very nice. And also we can see how this hyperpigmentation disappear also. It's because of this connection of ingredients that we use during one session is very important to do all three steps in one session, in one day, in one treatment. How beautiful is the result. Even one session and we can get it. It's a dream. Also, it works very good with stretch marks. And you can see this improvement of the skin after 3 sessions. This patient had a lot stretch marks. She got 20 kilos when she was pregnant, and then you can imagine quality of your skin. And now she have very good result, and very important that she told me that she can feel your skin. Can you believe it that she didn't feel her skin? She hadn't this sensibility of tissue before, and after 3 sessions, she again started to feel her skin when she applied creams or she's getting shower. She can feel her belly. Is amazing result. Um, we can back to our patient normal quality of life. It is also very important. This improvement only after one session. It's very important, the remark that I want to tell you. When you work with body, is better if you will use the cannula. For face, is better to use the needle, but for body, better to use a cannula. I use 25 gauge, 25.5 millimeters. With cannula, we can do a very good subcision also before to inject the product. With cannula, it works very good. You can see the improvement of stretch mark on your legs. So I'm very happy to share with you this my wonderful technique. And if you have any question, I will be glad to answer. Yes, we have. What is the depth of the microneedling? The depth of microneedling is it depends from 0.5 till 2.5 for body. For face, I usually use 1 millimeter or 1.5. For body, I use or 2 millimeters or 2.5. Then another question. Do you do subcision before injecting hyaluronic acid? Yes. With microneedling, with first steps that we are doing this subcision. It's enough for face. But when we work with body, better to inject hyaluronic acid with cannula. When we can do this subcision with cannula, and then in this space that we create, we can inject hyaluronic acid and it will proliferate very, very well. And how many of the peptone achieve for a whole face? We need to use all bottle for all faces, also very important, because we need the concentration of polydioxyribonucleins. It means that enough amount for stimulation of recovering of regeneration contains in all bottle in 2.5 in 2.5 milliliters. That's why we need to penetrate all this 2.5 milliliters into skin. Because of concentration, we need to give to cells this enough amount of ingredients. Only then we can stimulate regeneration. It's very important. So we apply the whole bottle, whole vial to the patient. We always use the whole of DNA peptide. If you don't have any questions, or you have questions, or maybe you will start to work with this technique and some question will appear, you can text to us, to your manager. They will call or speak with us, and we can give different recommendation. And also you can text directly to me to WhatsApp. To WhatsApp that my number will give you your distributor, your manager. Also, you can find me in Instagram, and you can write me to the direct. You can find me like Tsebrovska, like my surname, Tsebrovska aesthetic, and you can ask me whatever you want, and maybe you need any consultation about technique or about the patient. I will be always glad to help to all of you, and also I will be very happy and appreciate if you can share with me later your results. We will appreciate it a lot. We can post your work, your results with your name in our website, in our presentation, in our lecture, PowerPoints, to show how the whole world with different type of patient, with different type of skin can get this wonderful result with this technique. And we can share to each other this our experience, and it will help a lot. If you have any doubt or any problems, please also contact with us, and we will discuss everything and find a solution for that. Another question. What about the ml of the peeling? Usually for whole face, in this case, for have this very soft, for this very soft influence, I need only 0.5 ml of skin recovery pill. It will be enough, because we don't need to stimulate very aggressive effect for the skin. We need just only to stimulate some processes. We just only need to give a little bit of negative stimulation. That's why 0.5 ml will be enough. Absolutely. Okay, we don't have any questions anymore. I appreciate you all for being with me all this time and discover this experience. So I will be glad if you will get wonderful result with your patient. Is very easy to perform. Really, is very easy to apply this technique. You don't need any extra equipment, any extra super knowledge. You can use everything that you use in your daily practice. That's it. There's only of combination of techniques and about combination of ingredients and different products, and we will get these wonderful results. Please share with us your results that you will get, and with all questions we are happy to answer and to help you in our website, or directly you can text me in Instagram. Hope to see you soon. And I wish you a wonderful evening and a very good end of the day and very good experience with all your practice. And see you soon.